Many babies face life-threatening difficulties when they're born premature. They often have to stay in the neonatal intensive care unit or NICU from 2 weeks up to more than 6 months after they're born, depending on their overall development. Compared to the mother's womb, the NICU environment can be quite stressful to premature babies. Music therapy can greatly help premature babies by making them feel less stressed, by increasing their oxygen saturation levels, and by lowering their heart rate levels. All this leads to a better overall development, especially lung development, which is one of the key factors in the survival of a premature baby. They use a music therapy in association with all the medical care the baby will have in the neonatal intensive care unit is proved to decrease the number of days that the baby will spend in the hospital. Now we will watch a video that explains the use of the lullaby pacifier, which is one type of music therapy that has been used to help premature babies developed in the neonatal intensive care unit of Florida State University and the Tallahassee Memorial Hospital. The lullaby pacifier is basically used for 15 minutes at a time before feeding. It is used as an incentive to a more productive suctioning. What happens is that after the babies use the lullaby pacifier, they are fed, and they are able to ingest more milk than they would if they did not have used the equipment.
So we feel like we're accomplishing two major milestones. Music is an incentive. It's pleasant to the baby. They will suck a great deal more in order to listen to the music, and that transfers to a feeding skill, and they almost immediately go to independent feeding, sometimes with as little as 15 minutes of training, which is kind of a miracle when you consider how big this problem is.
And what we've seen is the babies that use the PAL, that they become used to that non-nutritive sucking. They're ready to eat sooner. They go home from the hospital sooner. They tolerate their feedings better. They're great.
I've noticed in the past 2 weeks since they've been doing this, they're finishing bottles, and we're actually starting to latch on to me, which is the end game. Anything to help Quinn and Rowan and make them stronger and get them, home sooner is, great.
Musical therapies have shown great results when used on babies who are 28 weeks or older, weigh 3 or more pounds, and are clinically stable. While it is not believed that musical therapy should be used on babies that fail any of these criteria. Not all music is appropriate for music therapy sessions in the NICU. Radio, CD music, and musical toys may be too loud or may contain melodies that overstimulate the baby and can harm a baby's developing brain. Melodies used in music therapy sessions must be carefully chosen to have specific beat, pitch, and noise level. The types of music therapies that have been used in studies and have shown the best results are mainly lullabies with or without added sounds, such as heartbeats and moon noises that have simple and constant rhythm. The results of a study that included 127 infants who received a recorded instrumental lullaby, a recorded maternal speech intervention, or routine care are that infants exposed to the recorded instrumental music were 9.9 days younger at discharge than those in routine care group. Also, in comparison with infants in the routine care group, those exposed to recorded maternal speech were 6.2 days younger at discharge from the hospital. Music therapy can have different impacts on a baby's oxygen saturation level, heart rate, and behavioral responses. 7 out of 8 studies regarding oxygen saturation level in premature babies reported that use of musical therapy resulted in an increase of oxygen saturation levels. In addition to that, the studies also suggested that music therapy leads to a decrease in heart rate of premature babies, particularly when infants are older than 31 weeks. Also, most behavioral changes such as an increase in quiet alert states, quiet sleep states, or a decrease in high arousal time were reported to have occurred during or immediately after a music intervention. Overall, the findings from these studies suggested that exposure to music therapy has beneficial effects on oxygen saturation levels, heart rate, and behavior from premature babies. therefore making it easier for premature babies to keep developing, leading to a shorter stay at the neonatal intensive care unit. Thank you.